Newsday continues here on One News Now. I'm Charles Lejano. The National Police approves a change in leadership at the PNP Academy following the death of a cadet due to alleged hazing. Meanwhile, the suspect, Steven Cesar Maingat, is now set to undergo inquest. To give us the details on this, we have Ryan Ang now reporting to us live from Silang, Cavite. Good afternoon, Ryan. What do you have for us?
Charles, PNP Chief Guillermo Elazar said that the leadership change at the PNPA is part of their review of the Academy's rules and regulations, academic policies, and aggressive reforms. Elazar approved and ordered the designation of Major General Alex Ampaga as new director of the PNPA effective September 29. Sampaga's current position as Director for Information and Communication Technology Management will be taken over by Police Major General Roderick Armamento, the outgoing PNPA Director. A criminal case was meanwhile filed against Cadet 2nd Class Steven Cesar Maingat in connection with the death of 3rd Class Cadet Carl Magsayo. The suspect arrived past 10 a.m. here at the Silang Municipal Police Station where he is scheduled to undergo online inquest proceedings for violation of Anti-Hazing Act resulting in homicide. This is separate from the administrative charges that will be filed against him, which Elazar say are grounds for his dismissal from the academy. Elazar added that this incident should serve as a stern warning to all PNP cadets that the PNP leadership does not tolerate misbehavior and serious breach of discipline and moral values. Elazar visited the wake of Magsayo yesterday at the PNPA compound in Silang, Cavite, where he gave the victim's family some financial support. Cadet Magsayo was allegedly punched 5 times by his upperclassman Maingat on Thursday evening. Magsayo fainted and was brought to the hospital but died later on. Charles, the remains of Cadet Magsayo will be brought back to his hometown in Zamboanga del Sur tomorrow. Elazar promised the family that the PNP will focus on the case and will make sure that justice is served. Charles?
Thanks for those updates, Ryan. That was Ryan Ang reporting live from Silang, Cavite. Pharmally executive Krizle Mago refuses to answer calls from the Senate. This comes after she admitted Pharmally changed the expiry dates on medical-grade face shields delivered to the government. In an interview with Radio 5, Senator Risa Ontiveros said that their offer to provide protective custody is still on the table, despite Mago's refusal to answer their calls. Ontiveros hopes that Mago will not recant her statement and continue helping the Senate in their investigation into Pharmally's transaction with the government.
Apparently, may communication pa rin siya sa ibang grupo at ibang individual. So iniintay na lang namin sa Senate Blue Ribbon Committee na kung papayag siyang mapa-protective custody namin. Kasi live pa yung motion kong iyon. Iniintay lang ni Chairman Sendic na pumayag si Ms. Mago. Handang-handa ang OSAA na i-extend yung protective custody sa kanya.
Meanwhile, Pharmally official Lincoln Ong has requested for an executive session to discuss the questions that he refused to answer during last Senate hearing. Because of this, Ong was not transferred to the Pasay City Jail over the weekend, despite the directive of Senate Blue Ribbon Chairman Committee Dick Gordon. The Agriculture Department confirms that the imported carrots in Maingat were smuggled from China. Speaking with Radio 5, DA spokesperson Noel Reyes said that the Bureau of Plant Industry has not issued a permit to allow the entry of carrots and other vegetables from other countries. Reyes said that the department is now working together with an interagency group to address the issue of smuggled vegetables as well as illegally imported meat and fish.
May unit po kami under sa kay Assistant Secretary Federico Lasiste. Siya po ang nakikipag-coordinate dun sa Consumer Affairs naman sa DTI kay Yusek Ruth, no? Castelo. At meron po sa Bureau of Customs at BIRs. Yung po naman nasa divisory ngayon ay titignan ng ating team, no? At para imbestigahan kung paano sila nakabili. Kumbaga sana back tracing. Malamang walang mga resibo yan.
PHIVOLCS says over 100 aftershocks were recorded following the magnitude 5.7 earthquake felt in parts of Luzon earlier today. PHIVOLCS Director Renato Solidum tells Radio 5's Filon that they recorded at least 112 aftershocks as of 5 a.m. and one of these reached magnitude 4.5. However, Solidum assures the public that these aftershocks are not expected to be strong or damaging, as these are occurring beneath the ground. PHIVOLCS says the public should be prepared for possibly stronger earthquakes due to potential similar movements in the Manila Trench.
Theoretically, kapag ang isang earthquake generator ay madalas gumalaw, ibig sabihin hindi siya talaga nag-iipon ng matagalan na babawasan yung energy. Maganda nga po na-release pero dapat isipin din ng ating mga kababayan na hindi natin pwedeng isipin na walang posibleng mangyaring mas malakas pa.
Hundreds of people lined up at a mall in Quezon City in order to get registered to vote for the upcoming elections. However, slots are limited, especially for walk-in registrants. To tell us more about this, we have Dale De Vera now joining us live from Quezon City. Good afternoon, Dale. What's the latest?
France is the last day of voters registration. Years for people trying to get in line, hoping to get a chance to have their voices heard in the 2022 presidential elections. This month in Quezon City opened a satellite registration center for residents of QC District 3 today. But with only few slots for walk-in applicants, some lined up as early as 11 last night to try to defy the last-minute rush in voters' registration. Kim, a first-time voter, had to wait in line for more than 7 hours to secure a slot. Others, like Gertrudis and Sarina, had to brave the long lines and be there as early as midnight. Both said they were busy with home and schoolwork, and that's why they had to put their plan of registering early on hold. The mall operator said lines started to grow at past 1 this morning. Pharmally, however, said build-up came at around 4 a.m. But even before the registration opened at 9 a.m., slots have already been filled. But hundreds of people still lined up outside. Local Comelec officials said only 300 slots were open for walk-in registrants, not including the senior citizens and PWDs. Charles, if you can see the local Comelec advises those who are still waiting outside, as you can see behind the booth, to try and register at other sites in the coming days, as the registration here at the mall will end at 7 this evening. Charles?
Thank you and stay safe, Dale. That was Dale De Vera reporting live from Quezon City. Some governments are considering the use of booster shots, at least initially, for their vulnerable sectors. But most experts are still not convinced that there's enough data justifying the administration of an extra shot. Let's hear the details from Bloomberg.
I know it's difficult to answer, but do I need a booster or not? And do I listen to the CDC or the FDA?
Well, at the end of the day, we're going to go with the CDC guidance that came out late last night. And that essentially boils down to if you're over the age of 65, you're eligible for a booster. If you have an underlying medical condition and you're 18 and over, you can get a booster. And if you're in an occupation that puts you at increased risk of coming in contact with individuals who might be COVID-19 positive, for example, hospital workers, long-term care facility workers, you're also eligible for a booster. So it's a rather broad swath of the population that will now be eligible for boosters here in the U.S.
Andy, you're in this profession. You've been watching the will they recommend boosters or won't they recommend boosters debate that has caused people to resign within some of the regulatory agencies in the United States. Have you ever seen such a public disagreement and a messy rollout of health policy before in your tenure in the field?
It's a really difficult time right now. It's clear that there is lots of data suggesting that boosters in the over 65 and those with medical conditions predisposing to severe COVID, boosters will help those individuals because it will boost their protection against severe disease. The debate really comes for the rest of the population. The data suggesting that boosters are going to be worth the extra protection that they might give is really not there. It makes sense to try to protect our healthcare workers, for instance, and so logically speaking, it's something that we should really consider, but the data isn't there in terms of how useful these boosters are going to be, and that's where the debate really is falling in.
Well, here's my issue with this, Andy, is the fact that we're talking about boosters really applies to only people that already wanted the vaccine. And there are still millions of people across the United States who remain unvaccinated. How damaging is the kind of mixed messaging from regulators, from science officials who people have been told to trust, to those who have decided that they don't want to get their shots?
This is such an important point, and it was really discussed in great detail at the CDC meeting yesterday. You don't want to send the message that essentially everybody needs a booster, because that implies that the vaccines aren't working. The vaccines are actually holding up fairly well, even with this onslaught of Delta, which is a variant that is much, much more dangerous than any previous SARS-CoV-2 variant that we've seen so far. So the critical thing to get this pandemic under control, particularly here in the U.S., but also globally, is to get unvaccinated people vaccinated. Boosters have a role, and again, we want to protect those vulnerable from severe disease, but this discussion of boosters is sort of taking away from the critical point for controlling the pandemic, which is unvaccinated people.
Well, and we know that there are pockets of unvaccinated people. It has been quite regionalized. Among those pockets includes a lot of the South, but we are actually starting to see cases decline in many of those areas. Should we take solace in that?
Well, you know, the infection has really burned through a lot of populations. We're getting immunity, but we're getting it in the wrong way. We're getting immunity in the population through infection, through hospitalization, through stress on the medical community, and we're only now going to start to see the effects of long COVID, which we haven't discussed yet because we've been so focused on the acute cases. But many of these individuals are going to start suffering long-term consequences from their infections, and we'll deal with that over the next 6 to 9 months or even longer than that. So it's such an important part of the discussion that has been sort of, again, not really the focus.
Here's a quick look at some of today's headlines. It's the last week of voter registration. Some Metro Manila residents waited all night long at COMELEC offices. The health department continues to see a downward trend in COVID-19 infections. But the Octa Research Group says it's still too early to downgrade Metro Manila's status to moderate risk. And in sports, Magnolia and San Miguel scored their first win in the quarterfinal series of the 2021 PBA Philippine Cup. And those are the top stories at this hour. Join us again later at 1 p.m. as we continue to monitor the day's biggest stories. You can also catch One News on Signal Play. Just register for a free account at www.signalplay.com so you can stream One News live anytime, anywhere. I'm Charles Lejano. Mask on, wash hands, and stay safe, Philippines. We are One News.